Hello, my name is Mary Beth Slins, and this is my speech over substance abuse. This is my audience, Adam, Shelley, Michael, Roy, and Deanie. Throughout the years, people have found many substances that they can abuse to get high, they use to escape pain, or use to avoid reality. They don't stop and think what harm they are putting themselves at risk for. Whether it is a variety of drugs or alcohol, the outcomes can be very dangerous. There are many risk factors of substance abuse. Whether the risk factors are mental or physical causes, substance abuse could damage multiple factors to someone's health. Even though it may be difficult to quit, there are numerous options to help you overcome addiction. There are many facilities around the world to help those in need of drug rehabilitation. There are also therapy options with and without a patient's family so that they can stop abusing drugs. Since there are thousands of risk factors linked to substance abuse of drugs, I will begin to explain a few physical factors. Many people who abuse drugs may be lucky that they get to live another day. Jody Redman, writer of The Dangers of Drug Abuse, stated that drugs like fentanyl and heroin are responsible for multiple overdose deaths on a daily basis in major cities. This is a major risk factor when abusing drugs, considering you may overdose at any moment. Even if you are not using fentanyl or heroin, abusing any kind of drug can lead to a drug overdose. Abusing drugs is accountable for the increased rate of aging of the cells in someone's body, according to Jody Redman. If you use drugs, they may not necessarily kill you, but they may shorten your lifespan significantly. Substance abuse can also lead to nephropathy. Nephropathy is kidney disease or damage to the kidneys, according to Jody Redman. Since your kidneys detoxify and filter your blood, a drug abuser's kidneys will become damaged to the amounts of drugs the kidneys are trying to filter out of their blood. Now that you know the physical factors, let's discuss the mental effects on substance abusers. Depression is one of the main outcomes of substance abuse. Researchers collected data from 10,000 patients who were being treated for taking opioids. In his article, Jody Redman explains they found that 10% of the patients developed depression over a month of taking opioids. In little over a month, these patients developed a very serious and dangerous mental health disorder. Also, those who use heroin are more likely to commit suicide. Those who use heroin are 4 times more likely to commit suicide than the average person. Whether they have a mental disorder or not, their chances of committing suicide increase drastically just because they use heroin. Even though getting addicted to drugs is very easy and fast, there are therapies that abusers can join to get over their addiction. Someone cannot just stop being an addict overnight. That's why there are all kinds of help for those who need it. Detoxification is the first step in treating substance abuse, stated Patricia Kelliker in her article, Withdrawal. For someone to recover from substance abuse, they first must cleanse their body free from all drugs so that the body can function like it did before the drug use began. Patients may also be given medication that will help with the withdrawal symptoms. Lyon Walsh explained in his article, Medication and Counseling Treatments, that medications used in MAT treatment relieve the withdrawal symptoms and psychological cravings that cause chemical imbalances in the body. Rehabilitation is one of the most common treatments for those who abuse drugs. Rehabilitation prevents patients from using substances in the future by behavioral therapy. Behavioral therapy can consist of many different methods such as cognitive behavioral therapy, family therapy, and positive reinforcement, according to Patricia Kelliker. Cognitive behavioral therapy helps the patient avoid and recognize situations that could lead to them using drugs again. Family therapy allows for the family to understand and see patterns of drug abuse while also teaching them different tactics to avoid drug use in the future. Positive reinforcement is basically motivational therapy. They help the patient in a positive way and reassure them that they can overcome their struggle. Clearly, the consequences of substance abuse can cause mental and physical damage to someone, so there are many options available to treat their addiction. The outcomes can be aging too early, which may not be such a bad outcome according to some. However, the other outcomes are in many ways worse. That's why there are many therapies and rehabilitation options for all addicts.